This is Caroline.
And this is Terri. Welcome to MedSurg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud MedSurg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
So unfortunately, Alyssa and Chelsea couldn't join us today, but we're very fortunate to have with us once again one of our favorite guest co-hosts, AMSN CEO, Terri Hinkley. Terri, how have you been? What's new up there in New Jersey?
Hey, Caroline, I just got to say, I love being like a guest co-host. I think it's one of the most fun things that I do. I love coming on and talking to you all. We've just opened convention registration, and I'm so excited. I feel like we need to get together. I was at the AONL meeting last week, and it was just so great to see people collected in a meeting again and able to meet face to face. And we're just so excited for September in San Antonio. It'll be 3 years since we've met in person, and the virtual conventions, I think, were good. And I think that people really appreciated being able to connect virtually, but it's just not the same as in person.
No. I totally agree. It's always a highlight of my professional year and my social year, really, an AMSN convention. And as I tell everyone, the speakers are always wonderful and the speakers are always relevant. And so for anyone that's listening, considering coming back to a live convention, please go to the AMSN website and check out the details. Good. I'm glad because someone was asking me this week, I can't register. What's going on? I said, well, I think there's a bit of a delay, but it won't be long.
There was also a tech update that we wanted to get out of the way before opening registration, because the last thing you'd want is that to be interrupted. So It's live and it's ready now. So How about you? How about you, Caroline? How are you?
Well, doing good. The biggest event in my life this past month was my eldest daughter got married. So
that's exciting.
Yeah, it was very exciting. It was a beautiful day. There really wasn't one thing that I would have changed. She had put such a lot of weeks and months into the planning of it all, and everything went off without a hitch. The weather was perfect and everyone looked perfect and the ceremony was perfect. It was just the best day.
Oh, that's awesome.
Now I have 751 proofs from the professional photographer to get through. I'm like, how on earth am I supposed to pick some for an album?
Yeah, no kidding. And like try and whittle it down to 20 or 30. It's almost impossible.
Exactly. So that's been the biggest highlight of my life recently. So
and that's such a great one. Congratulations to your daughter. That's awesome.
Thank you so much. Thank you. So today's topic, what do nurses, med-surg nurses, really think about travel nurses? What do you think?
I find it interesting because, and again, a lot of these are my opinions, but travel nursing's not new. I mean, my gosh, when I graduated from nursing in the late 80s, perhaps longer ago than I'd like to admit, but in the late 80s, I think I've told the audience before, I'm from Canada. There were a lot of nurses when I graduated that moved down to Texas and Florida on travel assignments. I mean, gosh, we had opportunities to go to Saudi Arabia on travel contracts. So it's not new, but I feel like there's been an amplification of travel nursing right now, obviously, with some of the concerns about the prices, which my opinion is always it's supply and demand. When you have high demand and limited supply, that's what happens, economically speaking. But I think that med-surg nurses, for the most part, recognize travel nursing fills a need. It certainly has been around forever, like we were talking about. And I don't think they begrudge travel nurses, quite frankly, the opportunity to be doing contracts right now. Anyone that I've talked to is like, yeah, absolutely. If I had the same circumstances, maybe I'd do the same thing. But I think that there's a shred of frustration, and I don't think it's with the travel nurses per se, but just that we don't seem to be trying to retain our nurses within the institutions.
Right.
To prevent kind of needing the travel nurses. What do you think, Caroline? Are you seeing that?
You actually made me think about something I hadn't considered. Yes, back in the 80s, in the last century, when we graduated nursing school, my goal was to get a couple of years experience and move to the United States. Mm-hmm. And I came on a permanent contract, but with one of these companies that hired travel nurses as well. And everyone was doing it. You mentioned Saudi Arabia, that crossed my mind, the Middle East. And I also work with several Canadian nurses that came down at that time. So you're right, it's not new. I'm wondering, though, what the reason for choosing travel nursing was back then as it is now. Money was always the enticement for sure. But now I wonder, with everything that has changed and given the last couple of years, do you think people travel to take assignments that they can be void of the politics? They can come in, do their job, and leave at the end of the day and don't get sucked in with the politics. I hear that.
And I think that it's also an opportunity for them, quite realistically, to say, I'm going to go and make some good money, and I'm going to use that towards my student debt or save for a down payment for a house, because those things are just so expensive.
Yes.
It's almost like an opportunity presented itself. And I do agree with you. I think that there's a piece of it, which is I'm going to go and do a 12-week assignment and I'm just going to do my job and then I'm going to leave.
Right.
But I also think that there's some attractive recruitment mechanisms there right now for travel nursing.
I mean, certainly back then, nursing school was not half as expensive as it is now. There are always facilities that don't offer tuition reimbursement, or it's not quite enough tuition reimbursement. And so if someone wants to do, whether it's 12 weeks or 12 months, they can knock out that student debt right there and then.
Exactly.
I agree with you. I don't think I agree with you in what you're saying. Regular staff do embrace travel nurses because they're filling a very big void right now. The challenges that we've seen in this neck of the woods is people quitting their regular jobs and then joining a travel company and coming back, not necessarily to the same facility, but one in the same organization, obviously making a whole lot more money. And so then the question comes, well, where's the loyalty? And then the question comes, well, if my hospital would pay me more, I would have stayed. And then you have to think about how long money motivates someone. You know, it's only motivated for so long. But right now, of course, sadly, down here in West Florida, we are losing so many nurses to travel assignments because they can go out and make good money, pay off debt, not get involved with politics, and give the best care that they can. So it's an interesting perspective. You can see it on both sides of the coin. And these are the arguments that I'm hearing. Well, I used to work with her. Now she's left and she's earning all this money. And it's like, who's the fool here? You know?
Yeah, no, exactly. You know, and it's interesting because I'm actually hearing that states are implementing requirements that you can only take a travel assignment so far from your home, meaning you can't quit your job and then get a contract with your same hospital as a traveler. Right. And they're really trying to sort of put some distance or say you have to go X number of miles.
Yes.
And I don't know if you're seeing that in Florida yet, Caroline, but I've heard that's happening in some of the states now. And I think you're right. But at the end of the day, the opportunity has presented itself. Yep. Nurses have seen an opportunity. And like you said, they're able to take care of some debt or save for some life circumstances that a full-time salary wouldn't allow them to do. And I think there might be some frustration for the remaining med-surg nurses, but I think most of them get it. I think they get why it's appealing.
Yeah, I think they're just glad to have help, for one thing, because also down here, our nurse-to-patient ratios are just extremely high. The other thing is the perception of a travel nurse. You know, are they going to be good? Are they going to be bad? Are they really just here for the paycheck? But I must admit, most of the travel nurses I've come across come to do a job. They know that it's going to be hard work. They know that they're not going to have a low nurse-to-patient ratio. That's what they signed up for. And for the most part, it's been pretty positive. Of course, we would always hope to try and hire. You could talk about it as a potential pipeline for some people coming just to take a look-see at the facility and the area. So I think the reception is fairly positive. It's interesting, though, I heard a comment from one of the nurse leaders who said, they leave and they make this money, and where is that left? Their previous co-workers, where's the loyalty? And the sad thing is, especially with the millennial generation, they're not worried about loyalty. They're not going to be in the same place for 10, 15, 20 years, and for them it means more experiences, different environments, different people, and they get to build their skill set. So there's some struggles and frustrations there, because they're coming and they're only going to be there for a short period of time. But it's an interesting phenomenon looking at travel nursing in the 80s versus the reasons for doing it now. I never took a travel assignment, I must admit. And I wonder now, looking back, why I didn't. I think just because it takes me so long to figure the job out to start with. Just when you get comfortable with it, it's time to move on, I think travel nurses have to be super flexible and super adaptable. Right. And that's a great trait to have. So I would say collectively that nurses look at travelers favorably, as long as it's not someone that's perhaps come out of their own nest and they feel like they're just throwing it back right
100%. Yeah. I've seen stories, and I just think this is great, of nurses buying campers, and they're going around in a camper and doing travel assignments. And I'm like, I never really had that travel bug, Caroline. Like I never really, and that's part of why it didn't really hold appeal for me personally to do travel nursing. But imagine if you're one of those individuals that wants to see the world and wants to travel around, and what a great way to be able to do so. I think that's just outstanding.
Exactly. In fact, I did some orientation for travelers a couple of months ago, and there was a lady that had been living in New Orleans during Katrina. And she said, that was my moment to realize that the city is underwater. This is going to happen again and again and again. And she had become a nurse later on in life. She sold her house and bought a camper and paid for it. And now she travels around the country taking different assignments depending on the weather or where she hasn't been to. Mm-hmm. And most of them are still working 3 or even 4 days a week, but that still leaves them 3 days to have fun, look around. And she said, the best decision I ever made in my life.
Yeah.
So you hear it like that, it's like, why don't we all do it?
Well, why wouldn't you? Right? Yeah, exactly. Why wouldn't you? Exactly. Maybe I'm the fool for not doing it. Carolyn, listen, I'm curious, how do you think that we within the institutions or the hospitals that these travel nurses are coming to, because I do think that our nurses appreciate that they appreciate their travelers, because they know that their shift would be a lot worse off without them, or their staffing ratios or their workload would be a lot worse off without them. But how do you feel that they're doing in terms of helping those travelers be successful? Are they onboarding them well? Are they kind of dumping the bad assignments on them? Or what have you seen and heard?
Yeah, it's a great question. Well, first of all, when I go back to when I was at the bedside in clinical practice, there was always the perception that the travel nurse would be dumped on. Mm-hmm. But in a charge nurse role, my thought was, well, these people are here to help. Yes, they're getting paid very well, but be that as it may, we don't want to really abuse their good nature. So I always try to be fair, because really all of our patients are sick these days. There's not an easy patient anymore. Now, fast forward to my role as education director, I would like to think that we give them a solid as onboarding as possible. We give them 1 or 2 shifts. These nurses are supposed to be flexible and adept to move in from system to system or hospital to hospital. So one of our biggest concerns from the education perspective, of course, is meeting all the regulatory requirements and making sure these nurses are competent to practice. And so we give them a pretty intense onboarding, a day in the classroom and then a shift on the floor. So I would like to think that we do as reasonably good job as possible given the time frame. Obviously, we don't want to spend the contract orienting them for half of it. And that's, again, one of the skills that they bring to the table. They are flexible. They do figure it out. If they don't, they ask questions. So it's certainly something to consider when you're on board. And we have a pretty robust packet followed by a PowerPoint, the opportunity to ask questions and make sure they have all the necessary tools, like their access to the medication dispensing system and the computer, and that they know how to use our charting system. Right. So we are very much aware of that from the education standpoint. Obviously, the first shift on the floor, you would hope that there would be a preceptor or a charge nurse, someone to guide them through, just to navigate the ins and outs of how to get things done. They kind of get the Reader's Digest version of everything.
Right. And I'm sorry if I missed this. Do you assign them a preceptor, or do they just go to the charge nurse if they have any questions?
Well, they have a preceptor for one shift.
Oh, okay, got
and
it.
then obviously they've got the charge nurse for as a resource as well.
Right.
Yeah, we don't entirely throw them out there, but obviously they don't get as long as an orientation as someone who's in a permanent role. But again, they're used to that. In fact, there have been comments about how thorough orientation is compared to other places that they've been to. One nurse said to me, "This is incredible." She said, "The last assignment I had, they literally threw me the badge in HR and said, the floor's down the hallway and off you go," kind of thing. I'm like, man, that's not very welcoming, and it's a little scary.
No.
And it's a little unsafe as well.
Yeah, and it's not really setting them up to succeed. So really, if you're not setting your traveler up to succeed, you're likely not successful on the entire unit, because it's just going to be a nightmare. Like, think about, do they know where to find the supplies? Do they know, to your point, do they have access to the medications? Do they know the EMR or EHR that the hospital's using? And are they familiar with that? I mean, it's certainly a much more complex system than ever.
Absolutely. And I think for a regular hired nurse, they sometimes forget, okay, there's a nice paycheck, but with that comes an awful lot of responsibility from the traveler to be able to pick things up very quickly and function independently very quickly without making a mistake. It's all our biggest fears, of course. I would say for the most part, it's a favorable reception. We're happy to have them. During the height of COVID, we were bringing in travelers in droves. I mean, most of our staff seemed like were travelers, but we almost needed it just to supplement the staffing because of the acuity with our patients that were COVID positive.
Yeah. And if it weren't for the travelers, you probably wouldn't have been able to get through it.
Exactly. There's always variables, of course. Someone, would say, well, they're just a warm body. But for the most part, they're effective warm bodies, and they're there knowing that they're there to do a job. And it's not going to be perhaps the best environment because of acuity, but that's the way it is, unfortunately, right now.
Do you think that travel nurses have a harder time when they're ready to stop traveling, going back into a full-time job if their resume is full of travel assignments for a couple of years? Or do you think we're past that?
It wouldn't be a red flag for me. If I was hiring someone and they had an extensive travel history, I think I would say as politically correctly as I could, are you done being on the road? Are you ready to find a home? And this is what most nurses will say. I'll do it for 2 years, 3 years, 5 years, or whatever. Now I'm ready to find a home. And of course, it's almost like an on-the-job interview. We're looking at them. They're looking at us. They pick and choose where they want to work. So if they come back looking for a full-time job, in some respects, that's a win for us. They like what they saw. They like the people. They like the environment. They like the culture. So that's a win for me. It wouldn't be a red flag, I don't think.
I just feel like traveling has been around for so long and we're all so familiar with it. Now, the breadth of traveling, certainly in the last 2 years, is, I think, greater than any of us have ever experienced. But it's not a new philosophy or a new way of doing nursing.
It really isn't. It really isn't. I think the only time I would have a red flag is if it were an employee that perhaps was marginal at best and weren't really a good fit to begin with, if they're coming back looking for a job. But otherwise, think about the experiences they've had. Think about the things that they've had thrown their way.
Oh, 100%.
Probably with very little support.
Think, Carolyn, about the things that they've seen and the best practices they could bring to you. We know that we learn really well from example. And if you've got someone who's like, hey, I worked at a place that was facing the same challenge and they did ABC, and you're like, that's awesome. Let's do ABC, or let's do maybe BCD because we're slightly different. It's just such a wealth of information.
Exactly. A new pair of eyes and a different approach can sometimes really shake up your policy and procedure manual and have you think about, are you really practicing in the most up-to-date evidence-based fashion? I've worked for my organization for 15 years now. And so you get encultured in that, but you forget what else is going on out there. And that's what a travel nurse can bring to you. And so certainly from what I've heard and what I recall when I was on the floor, we embrace them. We welcome them. We thank them for being there.
Right. Yeah.
And like you said, if it wasn't for the travel nurses, how much worse would it be?
You're just so grateful for more hands and more capable staff to be able to help you. I agree. That was certainly all my experience as well. Now, we didn't get travelers per se when I was practicing clinically in Canada, but we had a lot of agency staff. So there were staffing agencies that would fill in shortfalls.
Right.
That actually sometimes could be more challenging, Caroline, because if you were really short staffed on a unit, you got a different staff member or a different agency nurse every shift. And you didn't get any consistency. I'd much rather have a traveler where you got consistent staff for, 12 weeks at a time versus these, one-offs. But even then, we were grateful to have them. We tried to help them as much as possible. I mean, they'd show up at the beginning of the shift, so there was no orientation or anything else. And our charge nurses would usually do the best job they could, trying to say, here's where everything is. Here's what you need to know. Please let me know if you have any questions. And we would try and support them as a team as well. And I personally didn't have any experiences where we had someone that didn't work out. But have you ever had experience with someone that just wasn't a good fit and you had to kind of try and find them somewhere else to go on or move on to?
I've had a couple when I think back over the years that they simply were there for the paycheck. They had no interest in actually doing their job. And so therefore the patients weren't cared for properly. They weren't assessed. Medicines were missed. I mean, it was negligence. And so when you've got something as obvious as that's one of the luxuries, I guess, of agency or even travelers, and to say, this isn't working out, your contract is not going to be renewed, or your contract is going to be cut short, effective so-and-so. But it didn't seem to be a big issue. Most of these nurses were full of good intent and wanting to do a good job. Coming from England, I felt the same kind of way sometimes as the travelers, because this was a whole new healthcare system and a whole new country and a whole new environment. And so I was thankful for everyone that embraced me and nurtured me and brought me along, because then you pay it forward. And when you have someone that's as lost and new as I once was, then you pay that forward and you make sure that they feel like they're part of the team.
So, Carolyn, let's think about that for 1 second, because you weren't a traveler, but in much the same way, you kind of went to a different, like you said, a new system. Was there one thing that stood out to you that folks did that really helped you feel welcome and at home and set you up for success? Was there any one thing that you can remember that you were like, oh my gosh, that made all the difference in the world?
I think just the receptiveness and the welcoming feeling that I got, really. I mean, at one point, there were at least a dozen English nurses coming every week to the University of Arkansas Medical Center. And so we were a novelty. People hadn't heard the accent. There was the curiosity. And with that then came the friendliness. Well, this must be a really big change for you. You're in a whole nother country, and let me know whatever it is you need. And we actually had a very nice program set up. We had a coordinator that we all kind of went through. She was kind of like the mother, and she took us to the car dealership to get the car. She took us to the apartment to get the apartment. She took us to Walmart for the first time. So she was very useful and helpful in the assimilating in a different country. Now, we, of course, had the advantage that we spoke the language. Coming now full circle back to where I am right now, we have started to hire international nurses from Vietnam, from the Philippines, from Thailand. There's the other one. Delightful people, absolutely delightful people. But the language barrier is the challenge, definitely, to the point where just this week, they're having problems taking verbal orders. They don't understand the accent. I'm like, well, sometimes I don't understand the accent and I speak English. But that kind of comes into play as well. Traveler, international nurse, agency nurse, that communication barrier could be a challenge too. So if there were one struggle to bring out, that would be it. But for the most part, these nurses want to do a good job and they want to provide excellent patient care, and they realize that they're here to help us out and dig us out of a very big staffing hole right now. So,
well, and I wonder, Carolyn, if you also feel that a struggle for travel nurses might be that they don't have that sense of team like everyone else on the unit does, right? Because they're just coming in for 12 weeks on average.
Right.
And then they're off somewhere else and they've got to go through kind of that whole getting to know people again for 12 weeks.
Right.
And I have got to assume, and this is a big assumption, and I welcome anybody challenging me if they think I'm wrong on this, but I've got to imagine that you've got to be a pretty good extrovert to do a travel nursing assignment, because you've got to sort of assimilate into a whole new team every 12 weeks or so.
Definitely.
But even the best extrovert, I mean, I just feel like it must be a struggle for them sometimes to just always trying to be part of the team, which I think some of us take for granted.
Well, I think so. You bring up a very good point. And there are some of them that will just kind of keep their head down and do the job, and they're not interested in making connections. But it's kind of scary going into anywhere for the first time. And it takes a lot of guts, a lot of courage to take a travel assignment for whatever reason. But yes, you're right. We talk about being a part of a team when we care for our patients. And yes, some people can be a little distant and not as welcoming as we would hope. So yes, you're right. That's a good point to bring up for sure.
So maybe one of those strategies, if we're thinking about how to help them integrate, is really trying to help them build those relationships. And
definitely,
like your organization, giving them a preceptor at least for one shift.
Yes.
And then they have the charge nurse that's a resource to them, but maybe just making sure that there's opportunities to sort of build those relationships with their team would be another strategy that would help them be successful. I wasn't even thinking so much about socializing with a team, but I was thinking about like going into the break room and, not knowing anyone to speak to, or perhaps not being invited or welcomed into the conversation. Or even I need help lifting a patient. I need help moving a patient. Who do I go to? Just those things that I think when we're part of a team that works together all the time. We don't perhaps consider that it might be challenging for those that are coming and working with us short term.
Yes, indeed. It's a good message to kind of put out there for everyone who works with travelers, because I expect there aren't many nurses out there that do not work with travelers right now. We've had instances where majority of our floor sometimes are staffed by travelers with just a charge nurse as a permanent staff member. And so they all kind of banded together because they were travelers. So definitely a good conversation here. I think that travelers, for the most part, are seen as a favorable addition. There's always the ones that jump ship and then come back somewhere else. And that's always a little delicate. And then, of course, conversation for another time, when people say, why can't they just pay us more so we wouldn't have to have travelers? You do have to wonder that as well. And if that may be something that the senior leaders out there will have to consider going forward, because even without the pandemic, the average age of a nurse now is mid-50s. And if they're still at the bedside, they're getting to move away from the bedside or retire very, very soon. So
100%.
Certainly, I think more conversation to come on the use of travelers and bringing them into the fold for sure.
It's funny because I just always think to myself, it's not new. It's been around as long as I've been nursing.
Yes.
So, and I don't see it ending. I mean, even if we fix some of the problems, perhaps, that have led people to say, you know what, I'm just going to go and do some travel nursing for a bit. I think there's still those people that just choose that as a lifestyle, that they like the variety, they like the travel, they like the new experiences, they get bored easily. So I just don't think it's going to go away. And I don't think that there's an expectation that nursing thinks it'll go away either. But certainly, hopefully we can get to a place where maybe we don't need as many of them as we did over the past couple of years. And it'll sort of get back to kind of more pre-pandemic levels of travelers. But I'm just grateful for them. And I'm grateful because I just think we're so much worse off without travelers.
For sure. Like you said, they're not going to go away. Those productivity buckets will be looked at to get those numbers down, I'm sure. And so much more conversation to be had here. So it's been really great to have you with us, Terri, our special guest co-host. Thank you so very, very much. 30 minutes has flown by.
Oh, it's just never enough. I mean, my gosh. Carolyn, thank you so much. This is one of my most favorite parts of my job, honestly, when I get to pull out my microphone and jump on with you and have conversations. It's just so much fun. And
it's always a pleasure. And so For our listeners out there, we look forward to connecting with you on the next episode of MedSurg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official MedSurg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org. I'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You'll receive lots of cool benefits and perks, such as discounted pricing on our pending live annual convention and continuing education.
We also encourage you to help us spread the word and subscribe to the MedSurg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend MedSurg Moments wherever you get your podcasts to help us reach even more listeners.
And as always, the content within the MedSurg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Caroline.
And this is your guest co-host, Terri.
Yay.
And always remember, MedSurg Moments is a moment in our lives, a moment in our MedSurg careers that make a huge difference.